During this lesson, we will discuss the topics listed at the left. Each topic has a related objective. At the right, you will see objectives and an outcome for this lesson. At the end of the lesson, a quiz will be offered. You will receive a certificate of participation if you successfully complete the lesson with a score of 85%.
We'll do that together.
Let's take a moment to get acquainted with some of the navigation features within Healthcare Academy. An advance directive is a legal document in which a person provides instructions about end-of-life care, or appoints a person to serve as a decision maker for them in case they are no longer able to make those decisions. It gives a person the ability to make their wishes known to their family, friends, and healthcare providers in advance of serious illness, so there is no confusion in the event they cannot make decisions independently. An important point to keep in mind, the individual retains control for their own decisions after they have signed an advance directive for as long as they are capable of doing so. A person's advance directive starts only when the physician has certified that the person does not have the capacity to make their own healthcare decisions. The Patient Self-Determination Act of 1990 requires all healthcare facilities to provide information at the time of admission on advance directives. Advance directives, also known as living wills, advance decisions, or advance healthcare directives, inform individuals of their rights when it comes to their own medical care and decision making. Those decisions are then communicated by the healthcare provider. Click on the link at the right to learn more.
So these are some of the things that we should think about, or that the patient should think about when they're doing advance directives. You know, who do they want involved in their care? Where do I want to be when I die? Who do I want to be with? Who do I want to make decisions for me when I cannot? How do I feel about relying on machines to stay alive? Do I want everything possible to be done to prolong life? What kind of quality of life measures, such as pain management, do I want? And is hospice care a service that I would want at the end of my life?
Let's review what you have learned so far. The physician, healthcare proxy, individual who completes a directive, or individual's family retains control of healthcare decisions after the individual has signed an advance directive, while they are still capable of making these decisions.
What's the answer to that question? The individual, that's right. So the individual who completes a directive,
That doesn't mean that when they complete a directive, that now all of a sudden all decision making is turned over to that individual. If they are still capable of making decisions, then that's what they'll do.
Correct.
Yeah.
Advance directives are also referred to as living wills, personal directives, advance healthcare directives, or asset management. Click on all that apply.
What else? What else? There you go. Not asset management.
Correct. There are a number of formats for advance directives. They vary based on state law. The most common types of advance directives are living will, durable power of attorney for healthcare, do not resuscitate orders, or DNRO, and physician ordered for life-sustaining treatment, or POLST. The living will is a document that states a person's desires for medical treatment to be followed by healthcare providers, only if the person is unable to make decisions or choices themselves. The person must have a terminal illness or be in a persistent unconscious state for a living will to be valid.
Does everybody understand that? When is a living will valid?
When the person can't make a decision for themselves.
Not necessarily. So a living will is only valid when they're in a persistent vegetative state or they have been certified by 2 physicians that they have a terminal illness. That's when a living will goes into play in the state of Florida. Now it might be different in other states, but that's what the current regulation is for Florida. So unless they have one of these 2, now it can be an indicator for us, like for speech, for feeding tubes. It can be an indicator for us what they might want eventually. You know, if there's a hope for recovery, then they're not terminal. Then that living will wouldn't come into play. So then we would need to put that tube into the patient unless the patient says and is alert and oriented and says, no, I don't want that.
Living wills include information about a person's wishes, including pain relief methods, antibiotics, hydration, tube feeding, mechanical ventilation, cardiopulmonary resuscitation, dialysis, and organ and tissue donation. The directive can state that the person wants everything done, or that they want to limit medical interventions. It is important to make it clear exactly what is and is not wanted. Choosing not to have certain aggressive medical treatment done is not the same as refusing all medical care. The person can still get the treatments that are listed at the right. Living wills can be taken back or ended at any time. It is important to check individual state laws to know if, and when, the living will must be renewed.
So in the state of Florida, they do not require renewal of a living will. Once a living will is put into place, they can replace it with another living will or they can revoke it, but there's no requirement that they look at it every year or every 5 years in order to renew it. They can, once it's in place, it's in place.
Another type of advanced directive is the durable power of attorney for healthcare, sometimes referred to as a healthcare power of attorney or healthcare proxy. This document names someone to act on their behalf, a proxy, in the event that they cannot make their own healthcare decisions. The designated proxy will speak with healthcare providers on behalf of the person and make decisions based on previous directions. If the wishes are not known for a particular intervention, then the proxy will make a decision based on what they think the person would want. Some states have limits on proxy actions, so it is important to review individual state regulations.
Okay, so who knows what the difference is between a durable power of attorney and a healthcare proxy? What is the difference between them? So a durable power of attorney is one that is appointed by the patient. A healthcare proxy is one that's appointed by the healthcare institution. So let's say a patient is already confused when they get here, and they do not have a durable power of attorney, and we do not know what their wishes are, and they can't make decisions for themselves. There is a hierarchy, according to the state of Florida, that says who you appoint as healthcare proxy. The first one is the patient's spouse. If they're a minor, it's of course the parents. So the first one is the spouse, second in line are the parents, third in line are children, and then siblings. And there's a hierarchy, you can look it up on the Florida state regulations. So if you don't want your spouse or if you go down that hierarchy and you see who's next in line, you say, uh-oh, if I should become incapacitated tomorrow and I don't want that person to make that decision for me, then I have a durable power of attorney already written out and already ready to go in case something should happen to me. I tell my husband, these are the papers. If anything should happen to me, here they are. That way, because you never know what's going to happen with when you're out on the road or anything else. But it's something to think about. So a healthcare proxy is when the hospital where you're being treated at or when the healthcare institution appoints that individual according to the state law as to who is going to make healthcare decisions for you. And it might not be the one you want them to.
Persons who wish not to be resuscitated in the event their heart or breathing stops may choose to initiate do not resuscitate orders. Healthcare workers may also see these orders called do not attempt resuscitation, or DNAR, or allow natural death, or AND. These are all legal orders, signed by the person and a physician, that states that the person does not want cardiopulmonary resuscitation, or CPR, advanced cardiac life support, or ACLS, or intubation if their heart or breathing stops. Physicians, emergency medical service responders, and other healthcare professionals are legally obligated to honor these orders.
Okay, so the question of the day. If you do not have the yellow sheet for the DNR, but you have a DNR order from the doctor, and the patient codes, what do? That's exactly right. If they have a do not resuscitate order, they do not need that yellow sheet. That yellow sheet is only if they're outside on transport and they have to call EMS, then that's when they need that yellow sheet. But here in the house, if they have a physician that writes a do not resuscitate order, then that's it. You've got a do not resuscitate order and you do not code them. But where do we keep the indicators for it? So if a patient stops breathing right now, what is our process? What do we do? What's in their chart? What's that? Okay, so well, in their chart, there's either a green or a red sheet that sticks out of their chart. So you can automatically look at their chart and see if there's a green or a red. I would also double check. I would also call the code in the meantime so people can be assimilating the code card in case you need to start CPR. You can always stop the cart from going to the door if you find out that it's not, that they are a no code, they are do not resuscitate. So, any questions about that?
You always call the code, right? Always?
You always call the code. Yes.
Yeah, but we wouldn't know that. If we find somebody, we don't always know if they...
Right. When you find the patient not breathing, you would call the code and then you would check the chart. Because you don't want to waste any time. No, you can. If you have a do not resuscitate, yes, you can. You can stop.
When we call the code, we don't start until we got a couple of people there anyway, right?
Well, yeah, true. It's hard to start unless you need somebody to interview and somebody to compress. Questions? Everybody know what to do if somebody stops breathing in the gym. Do you know what to do? I don't have a... hello?
Therapist, she's talking to y'all.
Yeah.
Help me out.
Oh, okay. Do you know what to do if the patient codes in the therapy gym? If they stop breathing in the therapy gym? We're gonna get Joyce. All right, what if Joyce isn't here? Okay.
Usually we'll get a nurse or not we'll go for the crash part.
Okay. All right. Good deal. You guys know what to do if it happens in the dining areas, right? No. All right. The kitchen staff, do you know, and housekeeping staff, do you know what to do if you come across somebody that's not breathing? What if you walk in a room?
We'll run out and find somebody.
Run out and find somebody. There you go. Okay. No freaking out.
In many states, seriously ill individuals can express wishes for a set of specific medical orders and regarding what life-sustaining procedures they desire and have the doctor sign. The physician ordered for life-sustaining treatment should be kept on the person's medical chart and can be used across different healthcare settings. Not every state recognizes a physician ordered for life-sustaining treatment. Click on the image at the right to learn more.
So this is something new for Florida. Physician's orders for life-sustaining treatment. It's being used in some hospitals. This is what the form looks like. And it gives you more information, more specific information as to what the patient wants. I think I've only seen one patient admit with one of these, and it was from the Mayo Clinic in Jacksonville. But I haven't seen any others. I'm sure it will spread, and as it spreads, we'll share the information with you guys. But it's basically an advanced directive. It tells in specific circumstances what the patient wants to do. So it's of course good information for the nurses. Whether they want TPN or do they want a tube feed, do they want to be intubated, do they want a trach? It's more invasive procedures and more specific.
Let's review what you have learned so far. The living will can detail a person's wishes for distribution of their assets, A person's desires for treatment to be followed by healthcare providers. That the person wants everything done to prolong life or to limit medical interventions. Or a family's wishes for treatment of the individual. Click on all that apply.
Okay, so tell me, is it number 1? No. Number 2? Number 3? Okay. Number 4? No. No, a living will is not a family's wishes.
Correct. If an individual has a durable power of attorney for healthcare, it is not important to discuss wishes regarding life-sustaining procedures with the person acting on their behalf, because it is listed right in the document. True or false?
False. False. A durable power of attorney, all it simply does is tell them who we're going to go to for healthcare decisions. It doesn't always tell you what those healthcare decisions are.
Correct. Advance directives are legal documents. An attorney is not required for completion. Advance directives become legally valid once a person's signature is witnessed by 2 people not related to the individual, but know them well. Although laws about advance directives may differ from state to state, they are legally valid in every state.
So we can find there are free copies of advance directives online. So if anybody wants an advance directive, you don't have to pay an attorney to get one, or a durable power of attorney. Just go online, you print one out, and you fill it out. It just needs 2 witnesses. And those 2 witnesses need to be non-blood related witnesses.
States honor advance directives from other states, but they do not always apply equally. It would be wise to complete an advance directive for any state in which the individual spends a significant amount of time. Advance directives do not expire. They are valid until they are changed or revoked. They may be changed or revoked at any time, as long as the changes are documented and witnessed. In the event that a new advance directive is completed, the previous advance directive becomes invalid. A person should review their advance directive periodically to ensure it still expresses their desires. It is important to review them whenever there is a major life event or every 10 years. When a person has an advance directive, it is essential that they share it with their family, friends, and/or medical provider. When a person enters the healthcare facility, they should bring and provide their advance directives to the facility social worker, discharge planner, or facility designated person. In the event that an individual does not have an advance directive, decision-making would fall on the individual's family, physician, or healthcare facility. In the event that decisions cannot be reached, the court system may become involved in making decisions for the individual. Although loved ones may make the decision they feel is best, it may not be what the individual would have chosen given the opportunity. For this reason, advance directives are an important component of healthcare. Let's review what you have learned so far. Advance directives do not expire, are valid until changed or revoked, can never be changed or revoked, or expire after 5 years. Click on all that apply.
All right, so number 1?
Yeah.
Yes. Number 2? Number 3? Number 4?
Correct. Which of the following is true in regards to the expiration of advance directives? They expire annually. They expire every 10 years. They expire when one moves out of state. Or they do not expire and are valid until they are changed or revoked.
Which one? Last one.
Correct. You have successfully completed this lesson and it's time to take the quiz. Upon successful completion, if an individual has a durable power of attorney for healthcare, it is not important to discuss wishes regarding life-sustaining procedures with the person acting on their behalf, because it is listed right in the document. True or false?
False.
Correct. Which of the following is true in regards to the expiration of advance directives? They expire annually. They expire every 10 years. They expire when one moves out of state. Or they do not expire and are valid until they are changed or revoked. Correct. The living will can detail a person's wishes for distribution of their assets, a person's desires for treatment to be followed by healthcare providers, that the person wants everything done to prolong life or to limit medical interventions, or A family's wishes for treatment of the individual. Click on all that apply.
Which ones? What's that? The two middle ones?
Correct. Advanced directives do not expire, are valid until changed or revoked, can never be changed or revoked, or expire after 5 years. Click on all that apply.
1 and 2, there we go.
Correct. Advanced directives are also referred to as living wills, personal directives, advanced healthcare directives, or asset management. Click on all that apply.
1, 2, 3.
Correct.
This is my test for taking.
The physician, healthcare proxy, individual who completes a directive, or individual's family retains control of healthcare decisions after the individual has signed an advanced directive, while they are still capable of making these decisions.
Which one? 3.
Correct. Excellent work. You passed this lesson. To complete the lesson evaluation and print your certificate, please return to the course menu by clicking on the exit button above.
Okay, any questions about advanced directives? Did everybody sign in on the sign-in sheet? We'll give you credit for it. Those of you who need CEUs, it'll turn into CE Broker, so you'll get your CEUs for this module.